Hello everyone. Now we are going to discuss about a new chapter, inflammation. So what is inflammation? By definition, inflammation is a response of vascularized tissue that deliver leukocyte molecules of the host defense from circulation to the site of infection or damage in order to eliminate the offending agent. Basically, it's a response of vascularized tissue in the form of delivering leukocyte and different molecule at the site of injury or infection to remove this offending agent. What are the causes of inflammation? So causes of inflammation, there are numerous causes of inflammation. Broadly, they can be infection like bacterial, viral, fungal, parasitic infection or microbial toxins. Tissue necrosis may elicit inflammation. Foreign body like splinter, dirt, suture, etc. may also result into the inflammation, and immune reactions may also result into the inflammation. Although there are numerous reasons can be culminate into the inflammation, we will see later on. The sequence of events in an inflammatory reaction. So what are the events occur in an inflammatory reaction? First of all, a microbes or an infective agent or a tissue necrosis will be there. They recognized by tissue resident macrophages or known as sentinel cells. For example, macrophages, dendritic cells and mast cell, they recognize these necrotic tissue or infective microbes. After the recognition, they release various mediator and which result into the various action. First, they recruit the leukocytes, mainly neutrophil and macrophages. They release some plasma protein like complement and kinin, and by the release of the mediators, there will be vasodilation and increased vascular permeability, which result into the swelling or edema. The recruitment of leukocytes and plasma protein like complement and kinins, they will result into the elimination of the microbes or dead tissue. After the release and removal of these microbes and dead tissue, the cytokines of the later phases and growth factor will result into the repair. Inflammation are broadly divided into acute and chronic type. We will see the basic differences between these two. Onset in acute inflammation is in minutes or hours, although in chronic inflammation it takes days or longer duration. Cellular infiltrates mainly in acute inflammation is neutrophils, and in chronic inflammation mainly mononuclear cells like monocyte, macrophages and lymphocytes. Tissue fibrosis. In acute inflammation, usually mild and self-limiting tissue injury or fibrosis is there, but in chronic inflammation often severe tissue injury or severe and progressive tissue injury and fibrosis is there. Local and systemic signs. Usually local and systemic signs like swelling, fever, pain are more prominent in acute inflammation and less commonly seen in chronic inflammation. In the next lecture we will discuss about the acute inflammation in detail. Thank you.